I'm Tony Killeen. I'm the president of ADLM, and I'm a clinical pathologist and director of clinical laboratories at a university hospital. This is my daughter Olivia, who is also a physician. She is an eye surgeon. And this is my granddaughter Isabel, who is now 4 months old.
Hi. When Isabel was about 3 weeks old, she started becoming really sleepy, not eating much. It would be hard to wake her up for meals and just kind of fussy. And at first I thought, oh, maybe she's going through a growth spurt. But after this lasted for a couple days and she started getting more and more fussy and upset, I started to have this real sense of panic that something was wrong. And so on New Year's Eve, literally like 2 hours after we toasted to what a great new year it was going to be, we took her temperature and realized she had a fever, and that's what led us to go to the emergency room. And there was a sign on the wall that said it would be 2 hours, but they got us back immediately once they saw her. And when the doctor came in the room a couple minutes later, she said, "Ooh, this baby's very sick. We have to move fast." They drew blood looking for her blood counts. They catheterized her bladder to get a sample of urine, and ultimately they ended up doing a lumbar puncture. Being the parent of a baby in the ICU was so different and, terrifying. From the initial lab results, we learned it was a gram-negative bacteria. Then the next day we learned that it was E. coli. But based on the labs, they were worried that the bacteria could also be in her blood and maybe even in her spinal cord, so maybe it was meningitis. I think that the test results allowed us very quickly to hone in on the appropriate treatment.
I've been in laboratory medicine as a physician for several decades. Having my own granddaughter in the hospital, I was struck at how dependent the clinicians were on the lab test results that came back. And it was a reminder to me of how important laboratory medicine is in patient care. She was in the intensive care unit on IV antibiotics. She's on a cardiac monitor.
Yeah.
And it was a really dramatic setting for a 3-week-old baby.
It was truly the worst week of our lives, but we're incredibly grateful to everyone, from the phlebotomist who drew her blood to the laboratory technician. Truly, their talent, their speed at which they worked completely changed the outcome for her.
For people considering careers in laboratory medicine, and there's all sorts of different careers, it's a fantastic field and you can have a really important impact on patient care.
I would just say a huge thank you to everyone who contributed to Isabel's care, especially everyone in the lab. You truly made a difference in my daughter's life, in my life, and even though I never met you in person, I'm still very, very grateful to you, and what you do is so important, so thank you. Even though Isabel is too young to say thank you herself, we are so grateful on her behalf, and thank you for giving her this gift.